Welcome back, everyone. The United States is facing a critical issue, a nursing shortage. According to experts, the shortage is only expected to intensify as baby boomers age. Many states have turned to immigration to help lessen the impact, but as the White House's immigration crackdown intensifies, will we continue to be a nation that attracts much-needed nurses? In tonight's Prime Focus, our Christiane Cordero heads to Michigan, one of the states projected to have the largest nursing shortage by 2035.
For registered nurse Jarek Tabudlo, the journey to the operating room is long and not one he takes for granted.
I think the thrill of quote-unquote saving lives through surgery is kind of satisfying when you're closing the skin already. Patient was safe, patient was alive.
He works for Detroit's Henry Ford Hospital, an 877-bed Level 1 trauma center, the flagship of Michigan's expansive Henry Ford Health. Like many hospitals nationwide, Henry Ford is hiring.
This went down about 155.
The U.S. Department of Health and Human Services expects a nationwide nursing shortage will intensify over the next decade, projecting Washington, Georgia, California, Oregon, and Michigan will have the largest deficits. Chief Nursing Officer Eric Wallace says Henry Ford is down about 1,100 nurses.
This is not new for the nursing workforce, but definitely something that I think we're more focused on now coming out of the pandemic, because we saw a lot of nurses who were able to step out of the workforce, retire, move on. So we've got lots of things that we're working on to try to figure out how do we start to fill that gap.
One of those things is recruiting internationally.
One of those things is recruiting internationally.
In addition to the hundreds of hospital workers who cross the Detroit River every day from Canada, Henry Ford also hires from the Philippines. Why the Philippines?
The Philippines is a great place for a number of reasons. One is, and probably first and foremost, is they train their nurses very similarly to the way that we do here.
It's a relationship that goes back generations, with Filipinos today making up 1% of the U.S. population and 4% of the nation's nursing workforce.
How was your night?
For nurses like Felice Abad, the opportunity was in the profession itself. She was a nurse in the Philippines when she had a patient with abdominal bleeding. The fix was textbook, but one her rural hospital could not provide.
We couldn't do anything. There's no capability for surgery. So they had to talk to the husband and say that this is it. And I couldn't describe what I felt.
Helpless.
Yeah, helpless.
She was part of Henry Ford's first push to recruit Filipino nurses. Jarek arrived during the hospital's most recent efforts.
I was interviewed February of 2022. I was issued a visa, an immigrant visa.
In March?
In March 2023.
It has been decades since the U.S. passed major immigration reform. Today, delays in processing work visas and narrow limitations on the number of visas allowed means of the 400 nurses currently in Henry Ford's pipeline, only 25 have arrived.
We're really looking at a 2 to 3 year process right now. So that's a little bit frustrating, disheartening to some of those team members. I think it's amazing to me that so many of them have stuck with us.
He projects another 36 recruited nurses will join the health system by the end of the year, and adds if everyone they've hired in the Philippines were here and working, their shortage would be cut by more than a third.
If there's not enough personnel available to take care, the quality care will not be there.
Henry Ford is part of a larger group trying to address this issue through legislation that would funnel 25,000 of the necessary employment-based visas to nurses. The bill has been introduced and reintroduced several times since the pandemic.
And despite bipartisan support, we haven't seen one of those be passed into law.
The latest effort, introduced by Democratic Senator Dick Durbin in 2023.
We have medical professionals who want to come to the United States. We have shortages of medical professionals in hospitals and clinics all over the country. It's in our best interest, in the nation's best interest, and in the best interest of the individuals to give them that chance.
and co-sponsored by 10 Republicans, including Senator Tom Tillis. The bill did not make it out of committee and has not been reintroduced since.
So people need to wake up to merit-based immigration, to guest worker programs, because it's one of the single greatest benefits to our economy when we get people back to work.
Those against expanding the work visa program often say the healthcare industry should instead focus on improving the recruitment and retention of U.S.-born nurses. Foreign-born workers are undeniably woven into the labor force overall. A recent report found immigrants make up, on average, at least 10% of all workers in every major industry. In healthcare, it's roughly 17%.
We've got to expand the pipeline if we really want to solve the problem.
In the spirit of your perseverance, this administration hasn't been shy on their crackdown on immigration. Is there any reason to believe that this problem, the shortage itself, will get worse before it gets any better?
I tend to be hopeful, right? I think that if we're continuing to do the right things then and continuing to partner with our colleagues in other healthcare systems, that there are solutions that are out there.
Other regions have become more competitive in attracting foreign-born nurses, including the United Kingdom and the Middle East, which each have a more streamlined immigration process. What do you tell someone who perhaps you're recruiting right now and they say, I'm a little nervous to go and be a green card holder or just have legal protected status without being a U.S. citizen? Can I even come back to the Philippines to visit my family and then re-enter the U.S.?
I think what we tell them right now is that we've seen no indication that for folks who are coming here as part of this program that there's going to be any change in their process or their status.
Demand for employment-based immigrant visas in the U.S. is expected to continue, far outpacing the supply. Jarek says he's a resource for people back home considering the journey.
We are providing information about what's the process, how it is living here, what are the pros and cons, weather.
Is that a pro or a con?
Winter is not a pro, it's a con. I'm not used to winter, especially in Michigan.
Yes. He hopes to stay in the U.S. long term, as does Felice, who raised her son here and learned about their new home alongside him.
Having a child growing up asking me about the history of America, I have no idea. I have to help research, and now I get to know, oh wow, so this is America.
Where she found an opportunity to improve lives, including her own. What do you need the lawmakers to know?
These are folks who are trying to come here the right way, that this is literally the definition of the American dream.